If you're over 60 and you find yourself getting breathless walking to the letterbox, needing extra pillows at night, or your shoes feel tighter by evening, don't blame your age. Australian cardiologists now warn these slowing down signs are often silent heart failure, a buildup of fluid that can suddenly tip into hospital, lung flooding, and even death. Today, you'll discover the 7 breathless moments older women dismiss as normal aging and the simple steps to catch and reverse heart failure before it catches you.
Your heart is more than a simple pump. It pushes blood to your lungs to pick up oxygen, then sends that oxygen-rich blood to every cell in your body. But after 60, your heart muscle, valves, and blood vessels start to show the wear and tear of decades of work. Gradually, the pump weakens. You don't usually feel this as chest pain. Instead, you feel breathless. Your legs swell, you wake at night struggling for air, and you're constantly exhausted. Most women brush it off. I'm just getting older. Heart failure affects 1 to 2% of the Australian population, but that rate climbs sharply with age. Up to 10% of those over 80 are living with it. It's predominantly a disease of older adults, particularly women, and many don't realize they have it until a crisis, severe breathlessness, lung fluid, or hospital admission. The tragedy is that heart failure gives plenty of early warnings, but they are so easily mistaken for normal aging that women ignore them for months or even years. In this video, you'll learn the 7 breathless moments that Australian women over 60 dismiss as just slowing down, when they're actually early signs that your heart is struggling. You'll see how each one links to a weakening pump, why symptoms like swollen ankles and nighttime breathlessness are red flags, not inevitabilities, and what you can do at home to track your heart health. Most importantly, you'll know when to seek urgent help and how to prevent a hospital stay with simple lifestyle changes. Before we dive in, please comment below. Have you noticed yourself getting more breathless? Do your ankles swell by evening? How old are you? We read every comment personally. Your story might help another woman recognize a dangerous pattern early. Section 1. WHY your heart weakens. And WHY women are different. Heart failure doesn't mean your heart has stopped. It means the heart muscle has become too weak or stiff to pump blood efficiently. When the pump falters, blood backs up into the lungs, causing breathlessness, the legs, causing swelling, and the kidneys, causing fluid retention. Women develop heart failure differently to men. While men often have heart attacks that damage the heart muscle, women more commonly develop heart failure with preserved ejection fraction. The heart muscle stays relatively strong but becomes stiff and can't relax properly. This means women often don't get the classic crushing chest pain warning. Instead, they experience breathlessness, fatigue, upper back or jaw pain, nausea, and dizziness. Symptoms often mistaken for stress, indigestion, or panic attacks. Australian data shows that women are older at the time of diagnosis, have more comorbidities, high blood pressure, diabetes, atrial fibrillation, obesity, and are more likely to be misdiagnosed initially because their symptoms don't fit the typical male pattern. This delay can be deadly. Section 2. The 7 breathless moments that signal heart failure. 1. Getting breathless climbing stairs you used to manage easily. You could always walk up the 8 to 10 steps to your bedroom without trouble. Now you have to stop halfway, breathless and heart pounding. This isn't just being unfit. When your heart weakens, even mild exertion, like stays, leaves your lungs gasping for oxygen because the heart can't pump enough blood to meet demand. Key questions. Does your breath recover within 1 to 2 minutes of rest? Has this worsened over recent weeks or months? Do you also feel chest tightness, palpitations, or dizziness? A gradual decline in stair performance over weeks to months is often one of the earliest signs of a weakening heart pump. 2. Can't talk while walking uphill or at a brisk pace you used to chat easily with a friend while walking. Now, even on a gentle slope, you can't finish a sentence without gasping. Heart failure reduces blood flow to muscles, so even small efforts trigger breathlessness, leg heaviness, and fatigue. Ask yourself, does this happen even on flat ground now? Could you walk 30 minutes easily 6 months ago, but now struggle after 10? This progression signals your heart saying, I can't keep up anymore. 3. Sock marks deep into your ankles. Swollen feet by evening. By the end of the day, your sock elastic leaves deep grooves in your legs. Your ankles are puffy. Shoes that fit fine in the morning are tight by dinner. This is fluid retention. Your heart can't pump strongly enough, so blood pools in your veins and fluid leaks into surrounding tissues. In heart failure, fluid collects first in ankles and legs. Later it builds up in the abdomen and around the lungs, worsening breathlessness. If your legs swell every evening, improve slightly overnight, then swell again, especially with breathlessness, you need a heart and kidney check urgently. 4. Needing extra pillows at night to breathe comfortably. Lying flat makes your chest feel tight and your breathing shallow. You prop yourself up on 2 or 3 pillows, or even sleep in a chair. This is orthopnea, a classic heart failure symptom. When you lie down, fluid that pooled in your legs during the day flows back toward your chest. A weak heart can't handle this extra volume, so pressure builds in your lung blood vessels, making you feel like you're drowning. If you used to sleep flat but now need multiple pillows, you wake feeling suffocated and have to sit up to breathe, this is not just age. It's a warning your heart is struggling. 5. Waking suddenly at night, gasping for you. Wake at 2 or 3 a.m., breathless and panicked, needing to sit up, open a window, or even stand to catch your breath. Many women think this is a panic attack, but in heart failure, fluid slowly builds up in the lungs during sleep. When it reaches a critical point, it triggers acute breathlessness, called paroxysmal nocturnal dyspnea. If this happens and you also have breathlessness without exertion, a cough, especially with pink frothy sputum palpitations or chest pressure, seek emergency help. This can be the start of acute pulmonary edema, fluid flooding the lungs. 6. Unrelenting tiredness. You can't shake. A weak heart sends less oxygen to your muscles, brain, and organs. The result, you wake exhausted, struggle through simple chores, and feel drained all day. Many women blame depression, low iron, thyroid problems, or just getting old. Heart-related fatigue typically worsens with activity and improves slightly with rest. Comes with breathlessness, leg swelling, or frequent night urination. If your fatigue is unexplained and long-lasting, don't just check vitamins. Get your heart and kidney function tested too. 7. Urinating frequently at night, more than during the day. You barely pass urine during the day, but wake 3 to 4 times at night to go. This isn't just a bladder or prostate issue. In heart failure, fluid that pools in your legs all day re-enters your bloodstream when you lie down. Your kidneys then filter this extra fluid, making you urinate more at night. If this is paired with leg swelling, breathlessness, chest tightness when lying flat, it's a strong signal of heart pump weakness. Section 3. When to call an ambulance versus book an appointment. Call 000 immediately if you have breathlessness at rest that doesn't ease, chest pain, pressure, or tightness spreading to jaw or arms, sudden severe breathlessness with sweating, rapid weight gain, more than 2 kilograms in 2 to 3 days. With severe swelling, book an urgent GP appointment. If you've noticed worsening breathlessness on stays or hills over recent weeks, evening ankle swelling that improves overnight then returns, needing more pillows, or waking breathless at night, chronic unexplained fatigue with frequent night urination, don't dismiss these as just age. Early heart failure is treatable, but only if caught early. Section 4. Daily heart failure protection routine. Reduce salt. Avoid processed foods, takeaway, canned goods, cured meats. Aim for under 2 g sodium daily. Daily weigh-ins. Weigh yourself same time, same clothes each morning. A 2 kilograms gain in 2 to 3 days signals fluid retention. Monitor swelling. Check ankles each evening. Note sock marks and puffiness. Track breathlessness. Keep a diary of stay performance, pillow count, and night wakings. Gentle movement. Walk 20 to 30 minutes daily if tolerated. It helps circulation and mood. Quit smoking. Smoking accelerates heart failure and vascular damage. Medication adherence. Never stop or change heart, blood pressure, or diuretic medications without doctor advice.